Well, good evening, everyone. I'm Dave Bambry, and I serve as the Vice President for Alumni and Student Engagement at your University of Illinois Alumni Association. I first want to thank everyone for joining us this evening, as we're looking forward to another great session of our ongoing Alumni College Speaker Series. Before I introduce our speaker this evening, I want to take just a moment to talk about some amazing things happening at your Alumni Association. Over the last year, the association has relaunched its paid membership model with some great new benefits. We're very excited to bring this to our alumni, and I would encourage you to visit uiaa.org/membership for details about what all is included and to sign up today. Some of these expanded benefits include a partnership with the Krannert Center for the Performing Arts that will feature 2 member-only virtual performances each year, a chance to engage in career coaching, and discounts at the university bookstore, to name just a few. For those of you on the call who may be life members of the association, you are in an absolutely wonderful spot, as you will be able to access these benefits today at no additional cost. We are certainly grateful for the investment you made in your life membership, and we will honor that with your current suite of benefits. While we have introduced this paid membership model for those interested in the expanded benefits and offerings, we are still planning to have a lot of ways to engage at no additional cost. For example, our speaker series this evening will continue to be for all alumni, and other initiatives like our online networking and mentorship platform, Alumni Link, will also continue at no additional cost. We have a large number of alumni and students who have already signed up, and it is a great way to interact with those folks. The other item I certainly wanted to mention, as we are receiving quite a few inquiries on this, is the upcoming bowl game in Tampa, Florida. We are working extremely hard to finalize details around the events and programs that will be available for alumni and fans, so please keep an eye on your email next week for information and to register for those events. We can't wait to see you in Tampa, and we're certainly looking forward to cheering on the Alumni. Lastly, before I introduce our speaker this evening, I always like to remind everyone to please feel free to submit questions throughout the presentation through the Q&A feature at the bottom of your screen. We have left the time at the end for questions, and we will get through as many as possible with the time allotted. But let's get to why we are all here this evening, and that is to hear from a wonderful faculty member, and it is my pleasure to introduce her this evening. Tara Powell is Associate Professor at the University of Illinois Urbana-Champaign's School of Social Work. Dr. Powell's research explores the impact of behavioral health interventions in disaster-affected communities throughout the U.S. and internationally. She has developed and examined the impact of mental health interventions with children, families, and communities impacted by conflict, climate-induced disasters, and the COVID-19 pandemic. Powell's research has been funded through the Robert Wood Johnson Foundation, National Institute of Mental Health, and the National Academies of Science, Engineering, and Medicine. With that, it is my great pleasure and honor to turn the program over to Dr. Tara Powell. Dr. Powell, thank you so much for being here with us this evening. We look forward to a great session, and I'll be back with you for the Q&A. The floor is yours.
Great. Thank you so much, David, and thank you all so much for coming. I do want to apologize if my internet is a little spotty tonight. I'm actually down in Florida doing some hurricane work and trying to support some children who are affected by both hurricanes and COVID. And so I'm in Panama City avoiding the cold weather up in Champaign-Urbana in Illinois. So that's good, but I've only got 2 days away. So I will be back in the cold soon enough. So I'm going to go ahead and share my screen and start my talk. Tonight, how we'll look is I'll be providing, I do have a PowerPoint, but I also will be very interactive with you all. I'll ask some questions, and I also want to leave a lot of time for Q&A. So I've done many talks during COVID, and things have changed throughout the past 2 years. But I think we have a good opportunities for some really great and fruitful discussions and thinking about moving forward and recovery. So just right now, I'll go ahead and share my screen. So again, just tonight, what I'll be talking about is healing after collective trauma. So again, I want to have a discussion on just mental health and recovery from the COVID pandemic. Okay. I'm making sure I can click my slides okay here while I have it on screen share. So some of the objectives of tonight is, first, I want to talk a little bit about the lasting impact of the pandemic, both on us collectively and individually. I'll also identify some of the physical and mental health impacts of collective trauma events such as COVID. And then I'll provide an overview of individual and collective approaches to recovery. So again, I'm going to open this up for lots of chats and discussion, and so want to make sure that you all feel comfortable sharing if you can, and I look forward to talking a bit more in the Q&A session. So if any of you have seen me speak before, you know that I work in disasters, and as David mentioned, I've been working in disaster, trauma, and recovery since Hurricane Katrina hit in New Orleans in 2005. And so I've worked quite extensively in trauma-induced or in climate-induced disasters, and then so in other types of disasters such as conflict. But we do know, and I want to revisit this for those of you who haven't seen this before. For those of you who have, this can be just a refresher for you. But we know there is a typical disaster mental health response cycle in acute events. So say a hurricane hits, or an earthquake, or a flood, or in Illinois, tornadoes often hit. And so within communities, there's a typical mental health response cycle. So before the disaster, people get very nervous. There's a threat. You'll see on this left-hand side over here, we have emotional highs and emotional lows. So pre-disaster, we're kind of in the middle. Then when the impact happens, it's very stressful, but we don't go to significant emotional lows. We just have more extreme stress. And then right after the disaster, what you see is there's the heroic phase. So people want to come in and they are helping, they're helping save people, they're helping clean up the communities. And then after that, you see there's these emotional highs. There's the honeymoon phase, community cohesion, people building together and bonding together. But then over the longer term, you see the disillusionment phase. There's triggering events that remind you of the disaster or how long the recovery is taking, and remind individuals and communities. So many times I've worked with communities and they've said, when is this going to end? And honestly, like, I'm finding this very similar with the COVID pandemic as well. People are like, well, when are we going to recover? We just want to recover, and we want to just get back to at least our new normal. And so that's really that disillusionment phase. And then there's this reconstruction phase. So communities and individuals are working through their grief. There's anniversary reactions. You have a new beginning. And oftentimes, we tend to bounce back a bit better and actually are doing a bit better than we were prior to the disaster. So again, just a reminder, this is an acute disaster. And so this disaster response cycle looks very, very different than it has with the COVID pandemic. So what you'll see is stopped here. So I started documenting the COVID cycle at the beginning. And as it went on for 2.5 years, I kept thinking about it and kept thinking, well, what does this cycle actually look like? This isn't an acute event. This is a prolonged disaster. And it's also not just collective in one community, it's worldwide. And so I'm going to talk a little bit about this COVID cycle and tell you where I stopped and tell you where I've seen it go from there, because it's lasting much, much longer then you see this shorter cycle up. So you see up to 1 year after the anniversary. Well, we don't actually have an anniversary with COVID because it lasted so long. So you see similar emotional lows and emotional highs, and you see pre-COVID, we have in the middle, there was the threat when COVID cases were rising, people are feeling very nervous, and that was really at the beginning of 2020, first months. Then you saw our communities bonding together, saw people saying, let's support our healthcare workers. We're all, we're coming together, we're going to support each other. But then you saw that disillusionment phase, and that lasted a very, very long time. We had quarantine fatigue. There was also social challenges, protests, political unrest. Cases continued to rise. There was anger, fear, isolation, frustration, uncertainty. And then we had the vaccine. And so I don't have that on this visual, but people started to do a bit better, and people were, pretty excited. We're getting back up into recovery. But one thing that we haven't considered as much is that this is a protracted and prolonged traumatic event. And so the impacts are going to last a lot longer than something such as a natural disaster that's acute. It's one time. So with COVID, what we've really seen is that uncertainty, that loss, that's lasted for a long time. And I'm going to be talking a bit more about our stress response cycle as we go on, but I want to open this up to a chat really quick and say, what are all of the other secondary traumas that we've experienced in the past 2.5 years, in addition to the ones that I have on this cycle? And feel free to add in the chat and I'll reflect on them with you all. Yeah, social isolation. January 6th, yeah. Grief from losing loved ones, loss, the staggering death tolls, yeah. Isolation, loneliness, grief, yes. Loss of celebrations. Funerals online, so not being able to do our normal grief process. Yeah, disagreement about vaccines, family conflict. Off the first time in a pandemic, not as much support for students from school staff, yeah. Finances, yeah, disinformation, fear, concern about getting sick, grocery shelves empty, yeah, inflation, disruption in life and work, censorship, those who are naturally prone to anxiety about death and dying, housing crisis, quality education. Yeah, so those are just, there are so many things that we have went through throughout this time and throughout, the past 2 years. Others, some people have lost more. Some people have been impacted by inflation, more or less. Some people who have pre-existing anxiety. Well, all of us had a lot of anxiety throughout the pandemic, or not all of us, but I could say a good portion of us. But pre-existing mental health issues, that those were exacerbated. Uncertainty, job loss, so much job loss. Yeah, so there's been, so in addition to all of the stressors just related to just the pandemic itself, we had all of these other things too, throughout our community and throughout our entire society. Questioning, how do I want to live my life? What am I going to do now? There's rational and irrational fear. So yes, there's so many things. And so, that's really why I started this cycle. And then I realized as I was continuing to adapt this cycle for so many, for so long of the COVID pandemic, I thought there are so many issues that we have to address. Yes, we have. So yes, this job, worth getting sick for, or worth, passing for, is so lots of us started rethinking where we were going, what we were doing. And I'm going to talk a bit more about stress-related growth in a bit, but, a lot of us rethought, who are we? Because of all the grief and loss that we felt and experienced. So I thank you all so much for sharing. There's just so many things that we've experienced in the past 2.5 years that, it's hard to even quantify or show the cycle of what we've went through. So, generally, this is actually a good one. I see decreased access to mental health services. Yeah, and silent resignation. So that is another challenge that we've experienced. Also a lot of burnout. So mental health providers also are people, and they were experiencing out as well. And so, and also more people were needing access to mental health care. And so, just trying to maneuver all of these issues has been really challenging for the aggregate of the entire world, essentially. So what are common mental health symptoms after collective traumas? So stress, obviously. We've had prolonged stress, anxiety, depression, fear, anger, post-traumatic stress symptoms. Would anybody else like to share about other potential mental health challenges that I have missed in my quick slide? You can share in the chat if you like. Addictions, yes. Substance use went way up. Prolonged grief and complex grief, alcoholism, that went way up. So addictions can cope or use substances to cope with collective traumas, but the flip side of that is that actually can be negative over the long term. OCD, anxiety, challenges socializing, that's Nancy mentions minimization of stress because it's not as bad as others. So that's another thing that a lot of people experience is survivor guilt, or minimizing their experience because they see that others have experienced so much stress. And that's one thing that we see in collective traumas all the time is people often will, if they'll say, well, I'm not as, my experience isn't as bad as others. So kind of downplaying and pushing down some of the stressors that they experience. Yeah, domestic violence on the rise, mental fatigue. Yeah, so all of those things, there are so many mental health issues that have arisen as well. So I was interested and was thinking a lot about, and I've thought a lot about mental health and the long-term impact of the pandemic on both the individual and our wider society. And so, this is my area. I don't just work in disaster response. Most of my work is really in recovery. And one thing that I've seen, and I'm seeing again, very similarly with COVID, is that many they're like, let's get back to normal. We're back to in person. We have to stop this online stuff. Like, let's just go back to normal, or the new normal. Let's create a new normal. Like, let's just get going again. But the one thing we have to realize is we are still in the very beginning phases of recovery. And so I went back and I was looking at mental health statistics in the United States. And so there's a lot of statistics I could share, but I'm just going to share this one tonight. But what you'll see is I have this chart from 2016 to 2022. And so this is the prevalence of just general, this is all mental health disorders. And these are only diagnosed, mind you. These are only people who are actually receiving services. So there's many that aren't. So you'll see in 2016, they were about 18.5%. They went down a little bit in 2017 and 18, were declining, stayed about steady in 2019. And of course, in 2020, mental health challenges, were going up. People were seeking more treatment. And then 2021, you see it raising as well. So we get this vaccine, we get the vaccine in about 2021, or around there. But then you see this huge spike, which is a pretty high spike between 2021 and 2022. Yeah, so this graph is, so that's a good question. So this is for all mental health disorders. So this is adults and children. So this is general, and I can share the link afterwards because there's a 50-page document doing mental health by which disorder and range for each, and it's a really, really interesting. So what we see is we're seeing a big spike between 2021 and 2022. And that really also mirrors, what we see in recovery in general. Oftentimes we're on the go during the disaster. And when we start to go into recovery, those issues, those challenges don't go away. But, a lot of mental health issues that were kind of lingering or showing, appearing, actually are exacerbated. And so one thing I really wanted to focus on tonight and to get us to think about is how do we, recognizing that many people are still going through a lot of challenges. We know like adolescent suicide it has been at an all-time high. We know mental health issues are going way up across the whole United States. So recognizing, I think, is one of the first things and one of the really important things in recovery, because, it does take a long time to recover. And so there's a process, and it won't happen today or tomorrow. And I'm going to talk a little bit about patience, but patience and recognizing we have still went through a disaster, and it will take a long time for us to be back to or to get to our new normal and figuring out what it is. So I've already talked about all of these, these stressors, and back to my COVID cycle, these stressors all can be added in, and all of the ones that you all said as well. That social isolation, that's really was impactful for many of us. We're social creatures, and that can cause significant stress. So feeling like you're alone, disrupted relationships, the unknown, fear, all of these other issues, work-related stress, vaccine, variants, inflation, loss. I've talked about those all already. These are all things, and so many more things have really impacted us. And so recognizing it's not just one stress, it's not just one trauma. Many of us have lost family members and loved ones, maybe not even just related to COVID, but also related to mental health challenges, physical health challenges that went up during the pandemic. So I'm talking all dire here, but I do want to help us all recognize and really think about and remember that this, we're still going through that collective trauma, and there's a lot of things that we can do to support ourselves and to support each other during recovery. earlier graphic I showed you, it said up to 1 year. Well, usually I see even in hurricane recoveries, that can take a lot longer than even a year. That can take many years. So Hurricane Katrina, many, many years for recovery. And so it's just something we have to continue to recognize and work through. So now I just want to get a little bit into the stress response cycle. So I'm sure many of you have heard about the stress response cycle. It's a cycle we go through every day. We experience lots of stressors. Stress is normal. Stress can be good. But when we have too much of it, it can overwhelm our capacity to cope, and to also reach out to people we need to support us, because we're in the go, go, go. So we have an external stressor. So that could be anything. That could be something as severe as worrying about catching COVID without the vaccine. But it could be as minor as, well, driving can be stressful. But, say you have to get up and you have to go to work, and you have to drive. So there's the external stressor. And then there's this internal appraisal. So how do we appraise the stress? How do we view it? We're like, oh, this is, say this is so stressful, I can't handle it. What's our automatic response? Immediately. And then we have our physiological response. So our physiological response can be, say, for example, you get a rapid heart rate, you start sweating, you start feeling really irritable, and then we internalize that. And so this stress response cycle happens every day, all the time. And it happens in different ways to different stressors that we experience. So during COVID, we were experiencing so many stressors that, we weren't always able to complete the stress response cycle. So completing the stress response cycle is part of what we do. We have the stressor, we do internal appraisal, we have the response, and then we calm down, and then we go back to normal. And then, we just move on with our day. Say breaking news, we've got the tiger in the room. Is it the tiger being COVID? Is that going to get us? Well, what are these work-related stressors? Say you were working directly with people, with frontline workers, or you were working remotely and your hours were extended. So we've got all of these stressors. And so it was hard for many of us to complete the stress response cycle because we had the stressors were overloading us. And so when you have too many stressors that are overloading you, and you're not able to work through that cycle every day, that's a huge contributor also to burnout, ongoing depression, ongoing anxiety, because our capacity to cope was overwhelmed. And so I talk about the effects of these all the time. And, I'm going to ask for another sharing in the chat quickly. And then I'm actually going to get into some things that we can do and then open it up to a discussion. But so the effects of when our stress is overwhelming our ability to cope. So physical, our body reactions, being more susceptible to illness, also, gaining weight, losing weight, our emotional, intense, unpredictable feelings, cognitive, becoming forgetful, mental fatigue, mental fogginess. I know many of us have experienced that. Behavioral, you all mentioned in the chat, addictions, for example, or if you mentioned increased addictions. So these actions that we take, spiritual, so just changes in our beliefs and values, revisiting those and looking at those. And then social. So it impacts our social interactions. So COVID inherently impacted our social interactions. We weren't able to socialize like we used to be. But also when you're feeling overwhelmed and feels that can inhibit and also influence your social interactions. So you're not getting the support you need. So we had the dual experience of not being able to get those social interactions, and then also, experiencing these significant stressors that were overwhelming a lot of people's capacity to cope, so that they weren't even being able to seek out those social interactions or knowing how to interact very well with others. So I just want to ask and use effects that you've seen on yourself or anybody else in the past 2 years, or even more recently as we're going through the recovery. Yes, yeah, insomnia, yeah, fatigue. So you haven't, yeah, we've got two, we've got insomnia and fatigue. And so sometimes insomnia can lead to fatigue as well. Panic attacks, chest pain, yeah, anxiety, anger. Stay in bed more, social interactions more difficult, poor memory, weight gain, cognitive isolation, weight gain, yeah. Frustration, yeah, so it's that, behavioral, yeah, weight gain, physical. Yeah, one up there. Yeah, no one, I've said this since it started, no one can give anyone what they need. Lack of interest, dread, next hurricane or pandemic. Yeah, with social withdrawal, self-protection, tribalism, cognitive dissonance. Yeah. Compassion fatigue, less interest in going back to work, loss of faith in humanity. Yeah, so a lot of people are saying, so these are a lot of reactions on here, but just to go back, a lot of these, we're still in this disillusionment phase. So we're still dealing with this. And so that's, something to recognize. We are having these reactions. We're still dealing with this. Yeah, overwhelmed by the news. Actually had to stop watching the news myself because I decided it was too stressful. So I thought, how am I going to care for myself? I'm going to stop watching the news, only listen to things that are critical. Caregiver fatigue, yeah, challenging core beliefs. Oh, there we go. Rediscover spiritual side. Yeah. Okay. So I'm going to go. So I talked a lot about the bad, and I am at 6:35 right now. So I want to start talking a little bit about the good for the next 10 minutes or so, and recovery. And I also want us to leave with a little bit of hope and think about how we can both support ourselves and when I retired during the pandemic and have not gone into private practice like you planned. Yeah, so taking care of yourself is good. So I think the good thing is a lot of us recognize, wait, we need radical self-care. Self-care was in the news all over the place, but and we still need it. It didn't go away. We need that balance, because when you have too many of these things, so secondary traumatic stress, for example, and there's many more, compassion fatigue, anxiety, burnout, these are all interrelated. I know about a year ago, there was a whole New York Times, I believe it was New York Times article about languishing, so just not feeling interested in anything anymore. So these bads can sometimes outweigh the goods. And I think that oftentimes these can co-occur. So say, and I'm going to talk a bit about post-traumatic growth also, but you can experience post-traumatic growth and elements of compassion fatigue at the same time. So when we know when we're experiencing extreme or collective traumas, you know, we also are growing at that same time. We as humans are resilient. We have to be. Humans in general, we've always been able to, resilience is essentially adversity or about post growth and stress related growth. You get, that's the opposite of blame. You know, that can take a bit to work towards. So we're not always flourishing, but there's a lot of things, a lot of ways that we grow and we learn after these types of events, even though they're prolonged and it can be slow, and we can say, you know, when is this ever going to get over? When, you know, when are things going to be okay? I like that. I see one about growing, you know, during the pandemic, new, deeper connections, finding love from all over the world. Yeah. And so there's a lot of ways, you know, that we can also grow, but I think sometimes it's easier to focus on our stressors and the negatives rather than just looking at small things that have helped us grow and change over this time. So, yeah, we've got reorder priorities, learning online, gardening, local natural history, Zoom. Yes, more time with family. Yeah, so a big question. I actually asked myself as well, when and what does recovery look like? And talk with a lot of people. I've talked with many people over, you know, the past few years, like, what does this look like? Because this is nothing we've ever experienced. I like that. It's another one, new flexibility in the workplace. So what does this look like? So again, you know, there really is no timeline exactly for recovery. An individual's recovery will look different. Some people would need more support than others. One thing that, you know, I definitely want to bring up is that, you know, a lot of people have experienced significant loss. And collectively, one thing that we can do is, you know, sometimes we have compassion fatigue, but if somebody, you know, if you see somebody is really suffering and needs somebody, even reaching out to them or connecting them with some sort of resource to be there all the time for them. Okay, so I only have a couple more slides, probably about 5 more minutes, because I want to really get this Q&A and talk a bit more and answer any questions that are relevant. So, and not listen to myself talk as much, but I want to get some interactions with everybody. So I do want to talk about a few different elements that are in the literature. So we will continue to see as we're post-traumatic growth as an important concept in trauma recovery, so that you might gain both during trauma, but then after. So how do we grow? Reflection and newfound meaning. One thing, I'm going to turn off my video because I think I'm freezing. So hopefully I don't freeze as much. So reflection and newfound meaning. So reflection on how did we grow and through this whole experience, what is our meaning? Viktor Frankl and Man's Search for, and how he found meaning in the face of extreme adversity when in, when in a concentration camp. And so I think that's something that's really important to reflect on. So what is our meaning? Who are those important people in our lives? What is the newfound meaning that we've experienced? Then also stress-related growth. So what stress-related growth is challenging life events can really facilitate positive change. And then often people grow after a stressful event. And again, doesn't happen overnight, can happen slowly. And you might look at yourself in a couple of years and realize, oh, wow, okay, this is where I grew. So there are a few questions that I'm going to go through that just are some things to think about as you're thinking about stress-related growth. So over the past few years, what are ways that you learn and grow? So did you gain new knowledge about the world? Could be good or bad. Gaining knowledge isn't always great. Did you learn you were stronger than you thought you were? Did you become more accepting of others? Did you realize you have a lot to offer people? One thing that I found really common during the pandemic is, and for myself as well, I rethought how I want to live my life. How many of you have rethought how you wanted to live your life during the pandemic? I think that's pretty common. Anybody out there? Got a yes. So being able to reflect and thinking, what do I do on the day-to-day? Stress-related growth also having more meaning and satisfaction, looking at things more positively, learning better ways to express feelings. And those are only a few examples of stress-related growth. I didn't go through all of them. Yeah, sort of emphasis on flexibility, new thinking and behavior. We've got one went from being an ER nurse to being a homeschool mom and holistic life coach. Yeah, so it's very different amount of intensity there, but patience, yeah. Lots of retiring. Yeah, really come to appreciate time with animals. So looking and thinking about what are different ways we grow and learn what we do appreciate and change what we appreciate. And so I just have one more slide that I'm going to go through here because we have about 15 minutes left. But I do want to just briefly go over. I do want to read some of these chats. So learning how to slow down, evaluating what's been valuable in the past. Oh, this is fun. Having a chance to help with the birth of goats, friends farm, because you have the time. So we were able to take a little break, many of us, but some of us not. Some overworked and then being frontline workers and then not able to take a break. But yeah. Right. Oh, hi, Carol. I see you're on. Learning to be kinder and more thoughtful to others. Yeah. Okay. Learning how to use Zoom. Yeah. How many of us how many of us were Zoom experts before the pandemic? Right. Yeah. So when we think about resilience and recovery, there's so many elements to that. So social support is one. Finding healthy social support. There are so many different types of social support. Finding people you can talk to and connect with. Having friends and loved ones. Finding people you can have guidance from. That's another totally other form of social support and mentorship. Finding meaning in everyday life, even if it's small. Being more aware of our surroundings and just having little pieces of gratitude. Sometimes I wake up and I say, okay, I have to get to work right now. But I have to stop my morning. Having hope, even though when hope can seem challenging, you know, trying to have some form of hope in the future, having confidence in our coping ability. You know, so sometimes, you know, we all cope and there's unhealthy and healthy ways to cope. So finding healthy ways to cope, even if those aren't the only ones you use. So kind of that balance. Optimism and laughter. Laughter is a good one. That's something I want to integrate much more, and try to get more laughter and joy. Patience also. Um, Recognizing that you know, recovery doesn't happen overnight. And then finally, and there's more, but I just want to go through these ones that I come up with and we know work. Commemorations. So, you know, and having you know, trying to get those rituals back. So commemorating or remembering those we've lost, you know, coming together to, and it, so oftentimes in natural disasters and one-time events, they do, you know, the year remembrance. For this, you know, we have experienced a lot of loss. So coming together and, you know, remembering positively about perhaps you've lost somebody, you know, having some kind of commemoration for that person. Even during the pandemic, we weren't able to have those typical rituals that we had. So finding a way to have those rituals again and to commemorate individuals is another way that can help us recover. So I'm going to stop there. I want to just go with questions and discussions because then I talk way more than I thought I would. And so let's go to the Q&A. And my apologies if I froze a bit. So hopefully I'm not breaking up too bad.
Thank you so much, Tara. And no, you're coming in much better now. You were great for well, the whole presentation was wonderful, but you were going in and out just for a couple seconds there. So appreciate you working with us through the technical side of things there. But yeah, certainly want to jump into the Q&A here. We've got some great questions already. As I mentioned in the chat, if you do have a question, feel free to use that Q&A tab right at the bottom of your screen, and that'll put it into the queue for me, and then we'll do our best to get through as many as possible from here. So let's jump in. Tara, you had the chart earlier, and you made mention that kind of was an overview of all of the mental health disorders. But can you share, I realize you said it was a 50-page document. I'm kind of putting you on the spot here, but do you remember if there were any that just ranked the highest? And was there really a big disparity between adolescents and adults with how those ranked? And again, if you can't call on that study, I know you said you were going to provide the link later, so we can certainly do that as well.
Yeah, so I will definitely provide the link. And so, but I know anxiety related disorders were among the highest. And we saw a very, very steep increase in adolescents. So we saw an increase in adults, but there's definitely over time, like, and more recently, we've seen a steeper increase among young adults and adolescents. I wish I had this in front of me right now because I would love to share the statistics, but I'll share a couple of the reports so that people will have access to them.
Great, thank you so much. We received a couple of questions kind of in this realm, so I'm going to do my best to summarize. We had a couple folks that wrote in, parents of young adults and having to certainly live through this pandemic in a unique way with school. And we had one person mention they were sending their young adult off to college for the first time. And they said they feel like we're really just starting to scratch the surface of understanding the collective impact of COVID specific to that cohort. Do you have any insight really what the toll will be on that group and how best these parents can support their young adults and their college students as we move forward here?
Mm-hmm. Yeah, I think it's extremely challenging with those young adults who were in high school who lost all of that social interaction. We know in adolescence, it's the quickest time of brain growth outside of early childhood. And we know that having those social interactions are really important. And I know that we're seeing increased anxiety and depression in these young adults. So, one thing we can do is really, we can't tell them how to cope, but try to build those healthy coping skills within them, try to help them rebuild social support networks, and making sure that if you see something or if you see, any kind of change within, within your adolescent or young adult child, that you recognize them and try to refer them on. So don't just say, okay, well, they're always feeling, they're, I see they're anxious, but they're okay because, they've been coping with this for a while. But trying to get them to services as you can. Another thing that's really important is, or it can be really, really helpful, is support groups. And these don't have to be in terms of therapeutic support groups, but different kinds, getting young adults into support groups that help them realize that they're not so alone. We don't know the exact rate of what is going to happen, but we've seen these significant increases in mental health challenges, and we know that it's possible that it will continue to increase. So getting the supports that they need, recognizing, talking with them about it, are all things that we can do. I don't know if I think I answered that question in a few different ways.
No, absolutely. That's absolutely great. Again, a couple questions in a similar way here. So again, try to summarize a few, but essentially the crux of it is has there been kind of a comparable event in history that we may see that has this sort of longevity and trauma around it? We've had a couple people mention the 1918 pandemic, possibly something like 9/11. That was, obviously a nationwide event. Do you see any comparables that have been out there in history and similar traumas that exist as a result of that?
So in history, yes. The 1918 pandemic is definitely a good example. 9/11 was a one-time event, but it's very different because it threatened our sense of safety, and it was different in the way that it kind of changed our world in a different way. But this pandemic is a bit different because we are in a very different time, with technology the way it is, the way information is spread, all of the message. Our brains haven't adapted to this information overload. So we are getting this information overload in addition to this uncertainty and loss and isolation. So it's just another element that's added. So yeah, I see we get World War II on there, for example, as well. So yeah, so we've experienced collective traumas throughout history. The big difference with this now is really that technology issue, and the world has become a much smaller place. So in a lot of ways that can be good, because we are able to have access to resources, but in a lot of ways that can be not good, because our brains haven't learned to adapt to that, as I talked about, the stress response cycle of all that information coming in at us, and processing all of that. So I think we're going to learn a lot from this as we recover.
Absolutely. So you mentioned working with natural disasters and recovery from natural disasters, and obviously the trauma that goes with that. I'm hoping this is kind of within your realm enough to be able to speak to it, but we had a question come in talking about rebuilding after natural disasters, and if you found that kind of trauma surrounding folks that may have lost homes or or loved ones in certain areas, if they do tend to stay in those areas or if they branch out because the trauma becomes too much. And our question is specific to Sanibel and the Fort Myers area, obviously with these recent tragedies there. Do you see those areas get back to some form of normal, or do they really change forever as a result of those natural disasters?
They do change forever, but it's not always a bad thing. You know, so say I'll just go back to New Orleans, something about the levee system. So they actually they built an amazing levee system. The city still, floods a lot, but the risk of that catastrophic damage is much lower. But in regards to moving back, oftentimes that does happen. It depends on the individual, their level of exposure, their level of loss. I have seen many people who have never been able to, go back to the city or move back to the city that they experienced so much trauma in. And that's okay, because it was so much trauma and loss that it overwhelms their capacity to cope, and they've rebuilt and recovered somewhere else. And so it kind of depends on the individual, your experience, your resources, and supports where you are. But I have found many people who stay, but there's also many people, if they've experienced loss of their home, loss of loved ones, they don't ever go back. So they'll move to a different city and start anew. So I know that's not a very clear answer, but it kind of depends on lots of elements.
No, absolutely. And certainly complex issues here. There's not a one size fits all for any of this. So certainly understand that. I think you touched on this, a little bit or a lot late in the presentation, but we did have a question come through, getting back to normal and dealing with, everyone else who is starting to heal from this. Any additional advice that you would have? Again, I know that the last slide or two there talked on it a little bit, but I didn't know if there was any expansion that you'd like to do just to kind of help us close out the session here. We may have time for one more question after this, but I certainly want to be respectful of everybody's time as well.
Yeah. So I did mention it a couple times early on, and this is one thing I want to reiterate, is that we really do need to have patience with recovery, and not try to expect everybody or ourselves to jump right back in and say, okay, well, we say, for example, let's go with the transition from remote to in-person. Recognizing that, you might feel one way about something, but somebody else might still have a lot of anxiety about, say, for example, being in person. So not saying, okay, we all have to change to be in person and we all have to go out socially all the time. So recognize that we're all in different phases, and giving ourselves some grace and doing some self-reflection on where we are and what our boundaries are and where are we in the process, I think is one thing that's really important, because once we recognize that and have that patience and give ourselves that grace, then we're actually able to take the steps to really help ourselves recover. That's one of those first steps. And then also, if your coping capacity is overwhelmed, reaching out to people, finding those healthy social supports. Boundaries are so important, as I mentioned. It's knowing yourself, being mindful, also practicing those good coping skills, all these things about self-care we talked about early on, and we're not talking about as much now, but are more important than ever now.
Dr. Powell, thank you. We are at the 7 o'clock hour. As I mentioned, I want to be respectful of everyone's time, yours included. So I certainly want to thank you for a great session. I'm sure we could come back in 12 to 18 months and really think about, you talked about just starting the healing process here. So I'm sure things will look even different then. So It will be interesting, certainly, to see how things progress, and we'll certainly keep our eyes out for everything that you put out into the stratosphere to learn more about that. But I do want to thank everyone for attending this evening. We truly appreciate your continued support of our ongoing speaker series. It's a wonderful opportunity for us to feature our amazing faculty here at the University of Illinois. I hope you enjoyed the session tonight. I would encourage you to please keep an eye on your emails. We are working on our spring sessions of our speaker series, so we'll certainly be releasing those as soon as possible. So again, just please keep an eye on your email, and certainly check out our website, uiaa.org, for all things at the Alumni Association. And again, thank you for joining us. I hope you have a wonderful evening. Happy holidays, and we look forward to seeing you all again soon. Thank you.